Confidence is definitely a key to getting your dream job, but as much as we hate to admit it, self-confidence has a lot to do with being happy about the way that you look. If you've always wanted to enhance the way that you look and feel, we actually may have someone who can help you. Sacramento Surgical Arts specializes in cosmetic, facial, and oral surgery, and they can help you get the look that you've always wanted without having to undergo invasive surgical procedures. So here to explain more about some of their facial services is Dr. Heir of Sacramento Surgical Arts, and a warm welcome to you, Doctor. This is a very interesting topic. Let's talk about facial implants.
Sure.
Why do you think people want facial implants?
Well, a lot of people don't necessarily know that they need or want facial implants. It's when they come in, it's up to the doctor, the surgeon, to discern if they need them or not. If you hang a piece of clothing on a hook, it just hangs down. But if you put it on a hanger, especially a padded hanger, it fills out. And the reason is what's underneath. And what a lot of surgeons don't look at is the skeleton. So the first step is you have to look at the skeleton. Is the bone where it should be? And if it's not, what can we do to put it in the right place? Because by putting it in the right place, all of a sudden, you don't necessarily need a facelift. You don't need fillers or Botox and things like that. So an example would be, I have Tommy here. And
this is Tommy?
This is Tommy. So it's a plastic skull, and what you see is you see cheekbones, you see the gonial angles, you see teeth, and wherever there's teeth, there's bone. If there's no tooth, there's no bone. So if you look at older people that are missing teeth, sort of looks like their jaws are collapsed, and it actually makes people look older. If you look at younger adults, sometimes the chin is protruded. Pull up to the light, turn to your right, and look at the car next to you. Look at where their chin position is, and you don't have to be a surgeon to be an expert at this. Their chin may be a little retruded. If they're okay with that, great, but sometimes they're not happy with that. So that's when they'll say, well, there's something wrong. I don't like my chin, or I don't like my cheekbones, I don't have cheekbones, or my face is very thin, what can you do? And that's where these types of implants come in, and this is an example of a chin implant. You can either move the bone forward, so you don't need a chin implant, or you can go in surgically and just put a chin implant there. And so from the side, now obviously this is too big, it'll look like it gives some dimension in a forward direction.
Wow.
It's made out of silicone. It's not blue in color when we put it in, it's actually clear silicone. It feels like your own chin when you push on it. And you can use the same. It honestly
feels like one of the inserts I put in my shoe.
Exactly. That's exactly what it is.
Yeah.
It's made out of the same material. And you can put them in on the cheekbone, on the angles of the mandible, and they can be held in either with stitches or with screws, and they're removable.
They are removable? They are removable. Because that was one of my questions. So if someone decides that they want this, or perhaps maybe for some reason something's not working out, you can actually go in and remove that?
Correct. So again, if it's an implant that we put in, we can remove it. On certain people where the jaws are either too far forward or too far backwards, and again, just look at someone from the front and the side, and you can just tell that the face isn't in harmony. And again, if it doesn't bother them, no big deal. Not everyone needs it. It's whatever the person's own individual desires are. And if they feel that their jaws are too far forward or backwards, you can actually go in, cut the jaw, and move it forward and backward.
What is the benefit of doing an implant versus a facelift? Why implants over facelifts?
Implants are part of a facelift, just like fat grafting and Botox is part of a facelift. The more tools that you have in your toolbox, the more services you can offer. And so when a patient comes in, it's not hammer nail. So if your jaws aren't in the right place, if you don't have enough bone, then we need to put bone there or implants there.
So this allows more option to get exactly what the patient is looking for. It's not just, it's not one formula for everybody. There's something you can do for specific needs.
Right. So, and using the shirt as an example, there's only so much you can stretch the shirt out, or there's only so much you can take it in before it doesn't look normal.
Let's talk about dental implants though too, because I know that that's part of the picture as well. Let's talk about dental implants. What are they and how do they work?
So when someone's missing a tooth, and they could be missing one tooth or multiple teeth, the old ways of doing things was dentures or a
bridges,
bridge,
yeah.
right? The negative of dentures or bridges, again, you've lost tooth, and when you lose tooth, you lose bone. Bone is similar to soil on a hill. When it rains, the soil washes away.
So if you don't have the tooth, then the bone goes away.
If you don't have the tooth, the bone goes away.
Got it.
So what we can do is we can actually take cadaver bone and put that in there, and once we put cadaver bone in, we can add the implant. Implant is a two-step process. We actually work with dentists in the area, and an implant is just a screw-like device. It's probably hard to see. It's a screw-like device that goes into the bone, and this green attachment sticks out. We take the green attachment off, we put a tiny little screw, and they heal like this for about 10 days or so, and that's an example. Once they heal for about 10 days, up to 3 months, depending on the type of implant we use, and it depends on what else we do, then they come back in, we put this green attachment on, they go to their dentist, and the dentist makes a crown. The advantage is we have 30 years of research on this, so an implant can outlast a patient.
Wow.
And it maintains the bone, therefore it maintains youthful appearance.
And it's permanent. It doesn't
And it's
come in
permanent.
and out.
So you can bite into an apple, you can chew a steak. It functions to some extent better than your own tooth, because your own tooth you can get cavities and so on. With this, you still have to go to your dentist for a cleaning and so on, but you don't get cavities.
Wow. And I imagine, though, too, you'd still need to floss and brush.
You still need to
make
floss.
Sure your gums are healthy.
Yep, that's right.
But still, it's a tooth. You have teeth back.
Exactly.
Yeah, wow, that is
Exactly.
absolutely amazing.
Yeah.
So, Doctor, where can people go to find out more information about the Sacramento Surgical Arts? Because like you had just demonstrated with all these different pieces and fillers and being able to visualize what someone may be looking for, there is an art to this. I mean, this is very impressive.
Well, the nice thing about what we do is there's a science behind it, and then there's the artistic side.
Absolutely.
And one of the advantages that I think our group brings is we have the dental background and we have the medical background, so we can sort of work in both worlds and we understand it. So the best place to go would be our website to get basic information, and then call. Gina answers the phone for us, and then she can direct the patients accordingly.
Wonderful. Thank you so much, Doctor, and great visuals.
Thank you.
Yes, very, very appreciative.